Time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome to the Sam Lesante Show, folks. We're on location here on Broad Street at a new location. It's called Express Care. You know, I'm telling you about healthcare in this area. Lehigh Valley Health Network, okay, has been just exploding in this area. And this is a great opportunity, folks. And you're going to learn all about this place right here on Broad Street. It's called Express Care. And with me today, no stranger to SSP TV, Melanie, who is in the marketing department. Melanie, nice to see you.
Thank you, Sammy, for coming down here. We're excited to have SSP TV here to see firsthand what we have to offer inside Express Care.
So tell me about why here on Broad Street, and when you go inside, you're going to be flabbergasted what they have. What was the whole reason for this?
We decided to pick this location because we like to strategically place our healthcare providers throughout the community. We already noticed that a lot of our patients were coming here for their grocery shopping, to come down here to visit Miracoya, to visit the dollar store. And we thought that our patients, since they were already coming here, that this would be a great location for them to come for their healthcare services. The revitalization of our community is very important, and the hospital want to have a part of it. What once was an empty storefront is now occupied by not one physician, but several. And I think it's convenient for our patients.
So what can people expect when they come here? Because I know there's two areas here. We have the care, and then you have the pediatricians, okay? And we'll talk to them shortly. But what are the hours? Who should come here so we can educate the public so they don't go two different places?
Well, Express Care is also known as urgent care. And what that means is care on demand. So anybody who's in visiting out of town that may not have a local healthcare provider is welcome to come in our doors. We have emergency room physicians that will be seeing patients, so therefore instead of going to the ED, they'll be more than welcome to come here to see one of our emergency room physicians or advanced practitioner. Anything from a basic sprain, someone who may need an x-ray, someone who may have a common cold, or maybe from out of town may not be feeling right, they are welcome to come into Express Care. Our offices are open from 8 a.m. to 8 p.m. We're open nights and weekends. Usually when you have an emergency happen, your doctor's not in. Mm-hmm. So having an alternative option during evening hours is great, especially with pediatric patients. Someone who may not be feeling well on the weekends now has an alternative option to come here versus going to the emergency room. We guarantee that our patients will be in and out in under an hour, where at times if you go to an emergency room, it may be taking extra time depending on the severity of the case. So we welcome patients to come here of all ages, pediatrics through geriatric medicine. Here in this office, we have over 60 years of practice, physicians who have been working in the community for many years. We have James Caggiano, pediatrician. We have Stephen Glicken. We have Alicia Wainwright and Laura Temperine, who are nurse practitioners working on our pediatric side. On the emergency medicine side, we have Dr. Greg Jones, who has been well known in our emergency medicine department, and we have advanced practitioners that will also be working here as well, providing quality medicine right here in our downtown community.
So the only thing that I would be, and I think this is great, I mean, because it's walking distance for a lot of people. The only thing we're concerned about is that if you think you're having a stroke, or if you think you're having a heart attack, or something like that, how do we know the distinction? Because you're not taking care of all of the critical things here. I mean, I know your emergency care, if you get bit by a bee, or you're not feeling good, or etc. But how would you know the difference?
The difference is depending on the severity of the case. Some people may not know what goes to the emergency room or what we could be seeing in Express Care. What we can guarantee is come here first.
Okay.
Come here and we can make that decision whether or not we can treat it here. If not, the best thing is you already have that emergency room physician seeing you within a few minutes.
Okay.
And then that emergency room physician, if it's something such as an MI, a heart attack, a stroke, we will call up to the emergency department. We'll get an ambulance here. They'll be waiting for you, and we'll get you right into the emergency room right away.
And Melanie, I think that's critical. You know why? Because if you're having a stroke, and now that you just answered that question for me, God forbid someone should have a stroke, you come here, they could get that needle in there, whatever they need to prevent further damage. So it's a drop-off point or something right here in downtown Hazleton. Hazleton. So the hours are 8 a.m. to 8 p.m. Okay. And you have pediatrics here now,
Yes.
and we're going to talk to Dr. Caggiano and Dr. Jones. There's two Joneses here, right? One's a PA and one's the physician, okay? So folks, we're going to go inside now. It's a beautiful place. It's healthcare. Again, it just gets better here. So let's go inside and see what's going on. All right, now we're inside the Express Care, and I'm going to talk to a few doctors. The first doctor we're going to talk to is the medical director of the emergency care at the hospital, as well as Express Care, and he's no stranger to the show. We remember Dr. Jones here was on talking about Lyme disease, okay? So now, Doc, this facility here, okay, is unique as Lehigh Valley Health Network begins to continue to raise the bar in this area. What specifically will this part of the emergency area do for the community?
Express Care is an office-type setting where people can come in and get minor procedures done, like small sutures, tick removals, like we talked about before, things like that, coughs, colds, mild nausea, vomiting, just minor cases that don't necessarily need to be emergency department care, but still need to be seen in an urgent manner. A lot of times the family doctor's offices are booked up. Some people don't have family doctors, so this gives the community a great alternative to be seen in a timely manner.
Okay, so how should I know when I should come here? Because again, even if someone has, you don't really know what you have, okay? So, I mean, the best thing is to come here. So, is there a rule of thumb, well, come to Express Care when you have this, or go to the emergency department I have here, or does it really not make a difference?
It does make some difference. If you are having chest pain, if you're having terrible abdominal pain, this probably is not the place to come to. If you sprained your ankle, if you're having a little bit of nausea, vomiting, like we said, a small cut, this is a great place to come and get care that's going to be a little more expedient. We can get you in and out a little bit quicker. In a little different type of setting than the emergency department. The emergency department tends to be, loud, noisy, very busy. It's a little more calmer setting here, more like an office setting.
Okay, so let me go back a little bit, because you said, let's assume someone is having a heart attack, but they feel it's stomach problems and it's nothing serious to them, at least, or someone's experienced something that may turn into a stroke. If they come here, it's still a good opportunity to get, care to get you to the emergency room, correct?
Correct. If they were to come here and one of our providers saw this patient and had some concerns that this person was having a heart attack or having a stroke, they could be in contact with the emergency department right away, and we could either call for an ambulance to bring the patient from the Express Care to the emergency department, or if it wasn't quite as serious, just recommend by private vehicle. The great thing is that our providers here at Express Care are all the providers that also work in the emergency department.
Good.
So there's a lot of trust between the providers.
And the reason I say that, doctor, is, as you know, I'm a big baby. When I come here, I feel more comfortable. It's not like really going into hospital and it's care, Express Care, health care, and I'm having a little stomach problem, whatever. Sometimes I would fear to go to the emergency department because I'm afraid that, I feel better coming here, where you could diagnose, wait a minute, you do have a concern, So it makes it easier for healthcare. You know what I'm trying to say?
Yep, exactly. I think you're exactly right.
Yeah. So, which is great, because you could be saving a lot of lives, if people just decide, nah, it's just indigestion, or I'll take a pill. But coming up here, it's Express Care, and it's a beautiful opportunity for me to get some kind of care. Am I correct in saying that?
Yes, yeah, and then if, the provider sees you, if they feel there's something more serious going on, we'll certainly get you to the emergency department to deliver the level of care that you require.
Terrific. So, as the head of the medical emergency department, what can people in general expect when they come to Express Care on Broad Street here?
When you come in, you'll be greeted by the receptionist and register. Then when you come back to one of the rooms, one of the providers will see you. It's staffed by physician's assistants and nurse practitioners, who are what we call physician extenders. They are in contact with the emergency department physicians if necessary. They're open from 8 a.m. to 8 p.m. Monday through Friday, and then 10 to 6 on the weekends.
And holidays.
And holidays, that's right.
And folks, we're going to talk to Greg Jones, PA. This is Dr. Greg Jones here, who runs the both emergency departments. I think this is a great opportunity for our community. Don't you think so, Doc?
I think it's fantastic. Yeah, and one of the things that we hope is that those minor illnesses can come here and get care more expediently than they would in the emergency department. As you know, the emergency department can oftentimes get backed up where we don't have beds to see people. But for minor issues, this is a great place to come to get taken care of in a more timely manner.
Well, we wish you the best.
Thank you very much.
Okay, Dr. Greg Jones, and folks, they do a great job. Now let's talk to Greg Jones, the PA. So, as a PA, okay, tell our audience just exactly what is a PA?
PA is a physician's assistant. We also have certified nurse practitioners that work here. Basically what we do is very similar to what a physician would do. We do the physical exam, we get your history physical, come up with a treatment plan, prescribe medications when necessary, order tests when necessary. I've been doing emergency medicine for over 20 years now. All of our providers here are ER trained, ER experienced. We've all had plenty of experience taking care of patients.
Well, being a native of this area, okay, the advantage of having express care right downtown Hazleton, which I think is great, and it's another opportunity for people to see how Lehigh Valley Network is working and growing in the greater Hazleton area. How would you feel personally with what's going on with the network?
I think it's a very needed service in this area, as far as providing health care to the people that are underinsured, no insurance, or even if you're just your family doctor's not in the office and you have a problem that arises after office hours or on weekends. That's what we're here for, to provide that care.
And the times are 8 a.m. to 8 p.m. Monday through Friday, right?
Correct.
And then Sundays 10 to 6, and you're also open up on holidays, right?
That is correct.
Okay, so anyone could come here. I mean,
anyone.
It doesn't make any difference, all right? As I was talking to Dr. Jones, who and why should someone come here if they're having any kind of discomfort or whatever?
Okay. We're set up basically to take care of the run-of-the-mill injuries, sprained ankles, minor fractures, minor lacerations. We're here to take out sutures that were put in other facilities. We can take care of small boils, abscesses, coughs, colds, sinus infections, bronchitis. If you're having severe chest pain, severe shortness of breath, severe abdominal pain, we are not set up to take care of that. You should probably best go to an emergency department at that point.
And I brought that up with Dr. Jones and talked to Melody also about the fact that sometimes a person is experiencing something, but by nature some people feel it'll go away. They really should, if they're getting severe pains, go to the emergency room. However, if it's something that's just starting and they're feeling, if they come here, you could diagnose it quicker and send them up to the emergency room. I don't want to deter someone from making sure they're getting health care.
Correct. If they would come in, we would evaluate them. If we feel it's something more severe than what could be taken care of here, we have a very good working relationship with the physicians in the emergency room, with the emergency room itself. It's one phone call. If they're stable enough, we're a few blocks from the hospital. They could drive themselves. However, if they are unstable or having more severe symptoms, call an ambulance and we can have them there within a few minutes.
And you have, you're constantly in relations, speaking with the emergency room.
As mid-level providers, nurse practitioners, physician assistants, we have supervising our collaborative physicians that we must be in contact with, that have to sign off on all of our charts, all of our visits that are reviewed. But it's one phone call. We call up the ER, we talk to the attending physician that's on, tell them what we have, and get feedback from them or send the patient directly there.
Well, we talk about healthcare today. We were talking a little bit before we did the show. Physicians, assistants, okay, really have come a long way in their knowledge. I mean, like my wife was a registered nurse. Sometimes she just blows me away when she's able to know so much about what the body is and the medicines, etc. There's a lot of scrutiny and a lot of training you have to go through, correct?
That is correct. I mean, right now most physicians assistant programs are 5 years master's degree.
Yeah.
All nurse practitioners have had critical care nursing and then have gone on and usually have masters or higher.
Yeah. So people should feel comfortable. I know sometimes I want to see the doctor, okay, which I understand, okay, but thank God we have the experienced people like you out there, and you're certified nurses, right? And they have to go through a procedure as well, right?
That's correct. You have to be state licensed, and their certification and continue medical education requirements to keep that certification. And it is anybody's prerogative to want to see the physician, and we understand that.
Yeah.
However, allow us to assess you first. If you are still uncomfortable, then we'll bring in the physician.
Well, folks, I'm here at Express Care. Lehigh Valley Hospital, Hazleton is just expanding for your health care. This is broken down in two areas. We have the emergency care, right? And then we have pediatrician. And when we come back after the break, we'll talk to Dr. Caggiano, and he'll tell you about all the great things that are happening here. It's just a beautiful place, as you can see, as we're doing the show. The phone number is on the screen, folks, for you to call. We'll be back right after this break. Welcome back to the Sam Lesante Show, folks. We're on location here at the Express Care. Lehigh Valley Health Network continues to grow in the area, providing great health care. And the phone number is on the screen. And you can watch any of our health shows, as you know, on ssptv.com. All of the shows we do on healthcare is here. Talk to Dr. Jim Caggiano, who is, now you've moved, right?
Yeah, new digs.
Yeah. So you moved from the
old Destin Center. Yeah.
That's it. Now, well, first of all, why did you bring pediatrics down Hazleton?
For a couple of reasons. The biggest one, though, really is patient convenience. Mm-hmm. This location for the majority of our patients is just a whole lot more convenient. Mm-hmm. As far as the doctors are concerned, it works in our favor as well, because we're a little bit closer to the hospital. When since one of us is always on call to take care of hospital emergencies, both in the maternity unit and in the emergency department, it's just a real lot easier to be here rather than out on the airport beltway.
Now, the way this is set up, it's fabulous. You have the Express Care on one side and then the pediatric on the other side, correct?
Yes.
And you take care of everything like you've done up there at the Destin Center.
Exactly. We have the audiometry booth to do hearing tests. We do vision testing. We immunize kids. We provide child care as well as some sick care.
Uh-huh. Now, what other doctors are here? The entire pediatric department?
So far, the entire department is here. So while Dr. Glicken isn't physically here now, he's doing hospital rounds. Dr. Raimundi will be joining the staff probably before the end of the summer, certainly early into the fall. He's coming to us from San Juan City Hospital, actually by way of, he's a Penn State undergraduate.
Is that right?
Yeah. So we're really happy to have him.
You know, we talk about healthcare all the time, Jim. And when you talk about the healthcare we have here, people way back when we were talking about healthcare, and they say we had to go out of town and say now the whole thing has changed drastically, because we have great doctors in this area.
Yeah. Yeah, we have. I mean, the hospital's done a really yeoman job of recruiting critical subspecialists to the area. I mean, the availability, for example, of an increased presence in cardiology, and we have endocrinology now that we never did before. The physiatry component, the physical medicine, rehabilitation, that sort of stuff is really very, very helpful. In our immediate practice, we've been thrilled to have Dr. Shu, who's a very highly qualified pediatric neurologist, take care of us, and that's really unheard of in a town this size.
Mm-hmm. Well, the thing is that the compassionate care, which I think people like to see, particularly what you do. You're dealing with all those babies, and it's anything that we should know about coming up with the kids. What we should be doing as parents or guardians.
It's summertime. We're always worried about safety risks and making sure that parents know that it doesn't take very much water to have a real catastrophic event with the kids where drowning is concerned, and we're worried about first aid, and we're paying more and more attention, have always done, but more yet to the possibility of Lyme disease. There's just a lot going on, and it won't be too much longer, as you can tell, having walked through any place that sells stationery, that it's back to school time, and so we're going to be emphasizing immunizing these kids and making sure that the 5-year-olds who are going off to kindergarten are not only physically ready and fully immunized, but that they're socially and developmentally ready for being in kindergarten. It's a big important part of our practice and something that we enjoy doing.
Yeah, well, I think this facility is great, and I think it's a great opportunity for the greater Hazleton area. You know, like you said, you know, walking distance, you're right up the street from the hospital, so it works out very well. Wish you the best here, Jim.
Thanks.
Dr. Gajano, folks, and we're here at Express Care, brand new location for your health care. Phone numbers on the screen, folks. We'll be back right after this break. So there you have it, folks. You saw the inside, you heard the doctors, and Melody, all I can tell you is, once again, just for a review, Express Care here on Broad Street in the Hazleton Shopping Center. The reason for the move and what's provided here again.
We want to stress that the reason why we moved is for the convenience of our patients. We are open from 8 a.m. to 8 p.m. Monday through Friday, including weekends and holidays. So whether you have a common cold, you need an x-ray, you need some stitches, please choose us and come here. If it's an emergency situation, it's something we can't handle, we will get you directly to the emergency room and get that taken care of. If you have people in from out of town who are visiting and they don't have a local primary care physician, we will treat them, we'll get them out in a timely manner, and we'll make sure that we are raising the bar in our quality health care.
Well, there's no question about that, Melody. All the doctors that we've interviewed, you know, there's tremendous care in the area, and I wish everyone well here. It's another opportunity to keep people healthy.
Well, thank you, and thank you for coming down and visiting us.
It's always my pleasure. Folks, you're watching the Sam Lesante Show, and like I said, folks, the healthcare, no matter where it is in this area, has just been going through the roof. We'll see you next time.